Yes, the abstract is really part of the AML17 trial, where we randomized patients to receive 2 different doses of Daunorubicin at induction therapy. For many years, the standard in Europe has been a dose of 60 milligrams per meter squared given for 3 days. A few years ago, there was 3 randomized trials which compared a higher dose of Daunorubicin of 90 milligrams per meter squared done in Europe and the United States, but they randomized against a dose of 45 milligrams for 3 days, and that showed a superiority for the high dose, the escalated on 90 milligram per meter squared dose. We weren't convinced, however, that it was superior to the 60 milligrams dose that we have been using for some time, and so we randomized patients to 60 or 90 milligram per meter squared as induction therapy. Patients who then went on to receive a second course of DA chemotherapy using a slightly lower dose of 50 milligrams per meter squared of Daunorubicin. And what we found in our initial report was that there was no advantage for using the higher dose of Daunorubicin. And we reported that in the journal Blood last year. It was, however, a little bit more toxic. However, with further follow-up, we've now established that there was a subgroup of patients with the FLT3-ITD who appeared to benefit from this higher dose. They have a superior overall survival at 3 years of over about 56% compared to about 36% for the patients receiving conventional dose Daunorubicin. So this is an interesting subset that appear to benefit from a higher dose of anthracycline, and this has also been found recently in one of the American studies as well. So there seems to be a building up of evidence that this particular group of patients may benefit from high-dose anthracycline, which is really important to know because this is a group of patients who do less well with standard chemotherapy. The next step is that there are other drugs that we can use to target FLT3 inhibitors being one. So can we combine this new observation that we've made with FLT3 inhibitors to increase further the benefit in this subgroup of patients? So that's one of the things that we're interested in. There's also new formulations of Daunorubicin that are liposomal, and they may also benefit this subgroup of patients, and we're currently studying that in our AML17 trial.